Good evening po sa ating lahat. Welcome po sa ating special edition ng Kapihang OH. Tonight, we join the entire world in commemorating the World Day for Safety and Health at Work 2021 with the theme of Anticipate, Prepare, and Respond to Crisis. Invest now in resilient OSH systems. I hope everyone is safe and healthy wherever you are right now. Kami po dito sa Philippine College of Occupational Medicine, Quezon City Chapter, ay nagagalak na napaunlakan nyo kami muli ng inyong oras para makinig at matuto sa diskusyon natin ngayong gabi. Ako po ang inyong host, Dr. Margo Venus Dasalyaku, Public Relations Officer ng PCOM QCC. To welcome us all sa ating Kapihang OH Special Edition, ladies and gentlemen, our PCOM Quezon City Chapter President, Dr. Catherine Artais Carriaga.
Maraming salamat, Dr. Ku. Magandang gabi po sa inyong lahat na aming tagapanood at tagapagsubaybay mula sa iba't ibang panig ng Pilipinas at sa labas ng bansa. Sa aming kapamilya sa Philippine College of Occupational Medicine, mga kapuso sa Occupational Safety and Health at kapatid sa propesyon ng kalusugan. Isang mainit na pagtanggap mula po sa amin na bumubuo ng PCOM Quezon City Chapter. Sa ating special na edisyon ng Kapihang OH, isang karangalan na kami ay napaunlakan ng aming mga panauhing pandangan. Executive Director Noel Binag na Occupational Safety and Health Center, Honorable Josefina G. Belmonte, Mayor ng ating lungsod ng Quezon City. Isang nag-uumapaw na pasasalamat mula po sa amin dito sa PCOM Quezon City Chapter. Ang pandemyang dala ng COVID-19 ay nagdulot ng malaking dagok sa pandaigdigang problema sa lahat na aspeto ng lipunan, lalo na sa mundo ng manggagawa at kalakalan. Maraming negosyo, pabrika at sari-saring establishmento ang nagsara. Dala ng problemang ito. Maraming mamamayan ang nawala ng trabaho at pagkukunan ng pang-araw-araw na pangangailangan. Maraming buhay din ang nalagas. Dala ng krisis na ito. Ngunit sa paglipas ng mga buwan, maraming panuntunan na ang napatupad dito sa bansa sa pakikipagtulungan ng iba't ibang sangay ng gobyerno upang mapabuti ang lagay na ekonomiya, lalo na sa mundo ng paggawa. Ngayong gabi, ang aming organisasyon ay nakikiisa sa paggunita ng buong mundo sa World Day for Safety and Health at Work, ngayong taong 2021. Ito ay pakilala sa kabayanihan ng ating manggagawa dito at sa labas ng bansa. Kaya po ngayong gabi, sa ating mahalagang virtual na pagtitipon-tipon, kami ay lubos na nalulugod dahil kasama natin ang mga eksperto sa larangan na ito sa aming espesyal na edisyon ng aming kapihan sa temang Anticipate, Prepare, and Respond to Crisis. Invest now in resilient OSH system. Maraming salamat po at magandang gabi po muli sa inyong lahat.
Maraming salamat, Dr. Carriaga. For our keynote speech, let us all welcome Engineer Noel C. Binag, Executive Director, Occupational Safety and Health Center.
Ayun, finally. Gandang gabi po, Dr. Catherine Artais Carriaga and the officers and members of the Philippine College of Medicine, PCOM, our distinguished resource persons, including our very own Dr. Jing Florante, all of the participants to this webinar, Ladies and gentlemen, good evening po. Magandang gabi po sa ating lahat.
Magandang
I'm
gabi
very-
po.
Yes, opo. I'm very happy and honored to join you this evening to celebrate the 2021 World Day for Safety and Health at Work. On behalf of the Occupational Safety and Health Center, I would like to thank PCOM for organizing this activity and for being one of our most active partners of the Occupational Safety and Health Center in advocacy. Starting last Monday, the OSHC hosted a three-day webinar to celebrate the World Day for Safety and Health at Work. This morning, we held the culmination webinar where Dr. Ana Sofia Victoria Fajardo, ang haba ng pangalan, a PCOM officer, shared the best practices of the University of Perpetual Health, Binyan, on mental health policies and programs in the workplace. The theme of this year's World Day for Safety and Health at Work: anticipate, prepare, and respond to crisis, invest now in resilient occupational safety and health systems, stresses the importance of strengthening OS systems to recover from crisis and prevent them in the future. Lessons learned and strategies developed in the fight against the COVID-19 must be integrated into our national OS system to make our country resilient. The ILO, the International Labor Organization, World Day for Safety and Health at Work report identifies 6 main areas of national OS systems where investments are needed to make countries resilient. First on the list is the National Occupational Safety and Health regulatory frameworks. The second is the National OS institutional frameworks. The third is the Occupational Health Services. Fourth is the Information, Advisory Services, and Training on OS. The fifth is the Data Collection and Research on OS. And the last is strengthening OS management system at the enterprise level to prevent and respond to OS risks. The roles and importance of occupational health physicians, kagaya po ninyo, in a resilient OS system are vividly highlighted as the report provided an overview of the occupational health services. These bodies have the responsibility to conduct risk assessment, inform workplace policy and action, monitor the work environment, assess workers' health, and finally, provide preventive health services. During times of crisis, occupational health services are well positioned to respond to health threats in the workplace, as they are already well informed about the specific hazards facing workers in their sectors and are aware of any new risk that might emerge. They have played a particularly key role in the health sector during the COVID-19 crisis because maintaining the health and safety of workers has been critical to the continuity of services for the public. We must must value the contributions of the occupational health physicians, and indeed, we must invest in them. On our part, on a part of Occupational Safety and Health Center mandate, is we are here to instill the value of preventing work-related accidents and illnesses in all workplaces across all industries. Aside from technical services to establishments, we also conduct research, disseminate information, and conduct training on OSH. To improve the OSH management systems at the enterprise level, for this year alone, we will be conducting about more than 600 batches of free online OSH training for all safety officers, especially for those financially distressed micro and small enterprises. The safety officers play a vital role in preventing work-related injuries and illnesses, as well as in mitigating the spread of the COVID-19 in the workplace. Each workplace needs properly trained safety officers and occupational health personnel. And no workplace must be deprived of their services. Thus, I call on PCOM, the Philippine College of Occupational Medicine, and other DOLE accredited STO to also double your effort and provide training at the most affordable registration fees as possible. OSH stakeholders must work together to make all workplaces resilient. We must work together in the development and implementation of strategies to ensure economic recovery while protecting the safety and health of our workers. I'm happy to note that you have lined up 3 interesting, timely topics for discussion this evening. I encourage everyone to actively participate in the discussions and share the lessons learned and the strategies developed while battling this crisis called COVID-19 pandemic. I hope that this webinar, an investment on occupational health services, will immediately result to a doable and a resilient OSH systems at the national and at the enterprise level. Sa atin pong lahat, marami pong salamat at mabuhay po ang PICO. Maraming salamat.
Maraming salamat po, Engineer Binag.
Thank you po.
Salamat po. Ladies and gentlemen, a message from the Office of the Mayor of Quezon City Local Government.
Good evening, ladies and gentlemen. Maraming salamat po sa pag-imbita sa amin sa inyong Kapihang. Mahigit 1 taon na ang pakikipaglaban natin sa COVID-19. Kaya gusto ko kayong pasalamatan sa inyong hindi matatawarang serbisyo, hindi lang sa QC, kundi maging sa buong bansa. Indeed, this virus has changed our lives in all ways possible. It even brought out the worst and the best among our systems and practices. Hindi po na-exempt sa mga pagbabagong ito ang QC local government. Nang napansin na natin ang mabilis na pagkalat ng virus, isa sa naging focus natin ang agad na pagrepaso sa mga nakagawiang proseso at makapagbaba ng malinaw na guidelines para sa mga taga-QC. It was evident then and even now that COVID-19 transmission in workplaces remains high and it puts our workers in imminent danger. Back in March, we identified that workplaces are among COVID hotspots. According to a report made by our City Epidemiology and Disease Surveillance Unit or CESU, Of the positive cases they've recorded from last week of February until the second week of March, 14% of them, or 104 cases, occurred in workplaces with many employees. The risk of contracting COVID adds up to the current, existing, and emerging occupational and safety health risks, which I know all of you are very much aware of. Ang pangamba ng ating mga manggagawa at maging mga employer ay nadagdagan pa. That is why we immediately instructed our task forces and department heads to make regular rounds throughout establishments and workplaces in the city. This is to ensure that minimum health protocols are in place to avoid the spread of the virus. Nang muling isinailalim sa ECQ ang NCR Plus nito lang mahal na araw, nagkaroon tayo ng guidelines sa workplaces kung saan ipinatupad ang Alternative Work Arrangement Scheme. Ang resulta, bumaba ang bilang ng workplace transmission sa 12%. Tunay na malaki at mahalaga ang kontribusyon ng maayos at epektibong OSH policies sa pangkalahatang stratehiya natin para makontain ang virus at masugpo itong pandemya. Kasunod nito, gusto ko rin bigyan diin ang kahalagahan ng pagpapakuna na magbibigay ng herd immunity sa atin. I believe it is imperative for us in the government to also provide our people with protection through vaccination. Kaya naman nakipag-partner tayo sa private sector para mabakunahan ang mga manggagawang qualified. Kamakailan lang, binuksan natin ang isang vaccination site sa Skydome ng SM North EDSA kung saan medical teams mismo ng SM ang nagbibigay ng bakuna sa kanilang mga A1 to A3 na empleyado at mga residente mula sa parehong barangay at karatig ng mga komunidad. Sa pagtatapos po ng aking mensahe, gusto ko muling magpaalala na sundin ang safety protocols mula sa inilabas na interim guidelines ng DTI at DOLE. Kailangan natin magsuot ng face mask at face shield sa trabaho, maglagay ng mga acrylic shields, at maghugas ng kamay ng madalas. Iwasan din natin ang sabay-sabay na pagkain tuwing break time para makaiwas sa pagkalat ng virus. Inaatasan din ang mga opisina na magkaroon ng work from home arrangement at alternative work schedule para sa mga empleyado. Kailangan din ang tamang ventilation at regular na disinfection ng ating mga opisina. Nais kong batiin ang lahat ng miyembro at kasapi ng PCOM QC Chapter. Salamat para sa inyong pagmamalasakit at pagbabantay ng kalusugan ng lahat ng mga manggagawa. Ayon nga mismo sa PCOM hymn, and we agree, uunlad ang bayan kung kalusugan ay makakamtan. Masagana ang buhay kung malakas ang katawan. Let us continue to work safely and intelligently towards our collective healing. Maraming salamat po.
Maraming salamat, Mayor Joy Del Monte. To introduce our panel of speakers for tonight, let me call on our chapter chair of Continuing Medical Education Committee. Let's all welcome Dr. Maria Cecilia C. Dayan.
I am honored to present to you our panel of speakers. Our first speaker is Dr. Jeremiah M. Florante. Dr. Florante is an occupational health physician and occupational medicine specialist by profession. Prior to joining the government service, he was an industrial physician of a telecommunication group under Health Delivery System Incorporated, or Health First. He was also the occupational health physician of an information technology business process management company and another telecommunications company under Active One Health Incorporated. He was the former clinic director of the Health Maintenance Incorporated and former head of the Industrial and Occupational Health Department of the University Physicians Medical Center, now QualiMed. Right now, he is connected with the Occupational Safety and Health Center as one of its occupational health officers. He finished his baccalaureate studies at the University of the Philippines, Visayas, and earned his medical degree at the Remedios P. Romualdez Medical Foundation College of Medicine. He is a diplomate and fellow of the Philippine College of Occupational Medicine. Currently, he is one of the few certified Asian intensive readers for pneumoconiosis in the Philippines. A diplomate and fellow of the Philippine College of Occupational Medicine, he is currently the chapter vice president of its Quezon City Chapter. He was also the past national chair of the Special Courses Subcommittee of the Continuing Medical Education, Library and Research Committee of the Philippine College of Occupational Medicine. Next on our list is Dr. Rolando V. Cruz. He is a public health specialist on applied epidemiology for over a decade now. He is currently the program manager of STI, HIV, AIDS campaign of the Quezon City local government. He is the head of Quezon City Epidemiology and Surveillance Unit, leading the city's contact tracing activities on COVID-19 response. Our third speaker is Dr. Marilu Renales. Dr. Renales is an occupational medicine specialist, having trained at the National University of Singapore as Masters of Science in Occupational Medicine. She graduated MD from the University of the Philippines, Manila, and BS Botany from UP Diliman. A former chair and assistant professor of the Department of Environmental and Occupational Health, College of Public Health, UP Manila, she has been active in the academe, research, and teaching in professional organizations, medical schools, and STOs. As an actively practicing OSH consultant and OM physician, she has served in several multinational companies and currently in consultancy with 2 institutions. As a diplomate and fellow of the Philippine College of Occupational Medicine, she has actively served as a national director for 14 consecutive years, as well as secretary, PRO, and specialty board positions. She has also been an active member of the International Commission on Occupational Health for many years. There you have it, our panel of experts. Dr. Ku.
Thank you, Dr. Diana. Let me call on our first speaker, Dr. Florante, to discuss on COVID-19 and the workplace.
Thank you very much, Dr. Aku. May I be allowed to share screen? Thank you. Nakikita na po ba?
Yes, Dr. Florante.
Thank you very much.
You're welcome.
Okay. Good evening, everyone. For tonight's special edition of our Kapihang OH in commemoration of the World Day for Safety and Health at Work, my topic will be on COVID-19 in the workplace. There are at least 6 issuances from the Department of Labor and Employment covering the private sector and at least 3 from the Civil Service Commission for the public sector workers that I always think of when we speak of COVID-19 in the workplace. Tonight, I will be discussing the salient points of each issuance as we unravel the challenges brought about by COVID-19 in our workplaces. This time of pandemic, I always see Joint Memorandum Circular number 20-04-A series of 2020 issued by both the Department of Trade and Industry and the Department of Labor and Employment as a backbone of what has to be done in our workplaces with respect to preventing and controlling the coronavirus disease 2019 spread. Though this issuance covers only those working in the private sector, government agencies may adopt these guidelines. Anyway, we only have one goal, and that is to protect our workers from the dreaded disease. This particular issuance focuses on increasing physical and mental resilience, reducing transmission of COVID-19, reducing contact, reducing duration of COVID-19 infection in the workplaces. All this to ensure the safety and health of our workers. In increasing physical and mental resilience in the workplace at this time of public health crisis, it is important that our establishments develop workplace prevention and control programs and activities against COVID-19 to somehow assuage the anxieties of the workers. Psychosocial support must also be emphasized, including the promotion of work-life balance. The mere usage of right terminologies like physical distancing over social distancing provides impact to our workers. Besides, we really have to be socially cohesive but physically distanced to prevent the spread of the disease. Work schedules have to be respected as work time and family time becomes negligible, especially if you have a work from home arrangement. Hence, both the Department of Labor and Employment and the Civil Service Commission came up with the respective issuances on the development of mental health policies and programs in the workplace. Both issuances would require workplaces to set up referral mechanisms to address mental health concerns without discriminating the affected workers and an assurance of job preservation after the necessary health clearances. Part of increasing physical and mental resilience is promotion of a healthy lifestyle of the workers and and of work-life balance through proper scheduling of activities and workforce rotation. Proper wearing of face masks and face shields, observance of 1 meter physical distancing, and frequent hand washing must be strictly implemented at the enterprise level to reduce the transmission of the disease. Disinfection of frequently touched surfaces must be regularly done to avoid transmission of the illness through fomites, but we must make sure that proper personal protective equipment are being worn by the housekeeping personnel, not to mention the protocols that they must observe when donning, doffing, and disposing these PPEs. Safety data sheets must be readily available to guide our company first aiders should there be any accidents. Here is an example of homemade disinfection solution that we can use in disinfecting frequently touched surfaces. Again, safety data sheets have to be readily available and accessible for emergencies. Adequate ventilation is a very important element in the prevention and control of COVID-19 in the workplace. The Department of Labor and Employment recently issued Department Order Number 224-21, or the Guidelines on Ventilation for Workplaces and Public Transport to prevent and control the spread of COVID-19. To address the poor ventilation concerns in workplaces, checklist on monitoring compliance with workplace ventilation and the minimum ventilation rates in breathing zone are included in this issuance as its annexes. You may check the official YouTube channel of Quezon City Chapter for the full lecture on this particular issuance. As we have to promote frequent hand washing and other activities to reduce the transmission of COVID-19 in the workplace, infrastructures and proper signage or information, education, communication material place its strategic service to its workers would be highly encouraged as this limit the interaction to other individuals. Individuals who are not the colleagues of the not co-workers that may be carrier or infected with the disease. Reducing contact is also one of the strategies in the prevention and control of COVID-19 in the workplace. By saying reducing contact, we have to avoid crowded places, close contact settings, and confined and enclosed spaces. Being in any of the three or a combination or all of those three C's would mean greater risk of acquiring the disease. As such, We have to require our co-workers identified to belong to the most at-risk population for COVID-19 to work from home. This makes sure that our colleagues do not or will have a very limited face-to-face interaction. Instead, utilize available virtual meeting platforms. In 2019, DOLE issued Department Order number 202-19, providing guidelines to telecommuting or work arrangement that allows an employee in the private sector to work from an alternative workplace with the use of telecommunication and or computer technologies. I think actually this particular department order seems to be quite providential because um, this will be a full use, especially now that we are in this public health crisis. Similarly, in 2020, the Civil Service Commission issued Memorandum Circular number 18 series of 2020, providing guidelines for alternative work arrangements and support mechanism for workers in the public sector. Both issuances aim at making sure our workers are protected against the disease. However, work from home arrangements are not without safety and health concerns, as our homes are not designed as a workplace that may incur certain ergonomic issues and work-life balance may be disturbed. It would then be the task of the Safety and Health Committee of the establishment to make sure that workers availing from work from home arrangement will be afforded with the necessary support and assistance to address these occupational health related concerns. These concerns may be internet connectivity, work schedule, working conditions, mental health concerns, among others. These are some of the challenges working under the new normal. Establishments or government offices have to address these issues so as not to add unwarranted pressure on the workers and threaten the productivity of the organization. To those companies where work from home arrangement is not feasible, workers must follow certain protocols and employers must have an established coordination mechanism with the local government units. This coordination is very important, especially when the establishment has to conduct contact tracing and or refer cases, more so if the company is devoid of occupational health nurse or physician because of its size or risk classification. Regardless of the company's size and risk classification, establishments must make sure that health cases are being managed remotely. Again, this would reduce contact, thereby decreasing transmission of the disease. Organizations must also take into consideration the disease spectrum of COVID-19, so we will be guided on when to require testing and know the type of test that would be best for a particular scenario. However, let me just emphasize that reverse transcriptase polymerase chain reaction or RT-PCR testing is still the gold standard in testing for COVID-19. Furthermore, certain protocols have to be observed when requiring our workers to undergo RT-PCR testing. Testing should be collaborated as much as possible with the local government unit. All these activities have to be implemented and monitored by the Safety and Health Committee and be guided with the provisions of DOLE Department Order number 198-18 and CSC DOH DOLE Circular Joint Memorandum Circular number 1 series of 2020. Necessary reports must be submitted also to DOLE, to CSC, and to the local epidemiology and surveillance unit in accordance with existing laws and regulations relative to the reporting and notification of COVID-19 in the workplace. Leaves, entitlements, and other necessary benefits is to be provided to our workers depending on the circumstances or whatever is applicable to their case. However, I would like to promote this particular non-monetary benefit to our employers and workers as this would help curb the rise of COVID-19 not only in the workplace but in the entire country. Just recently, the Department of Labor and Employment issued Labor Advisory number 03-21 on the administration of COVID-19 vaccines in the workplaces. Coordinating with the local government unit, on this aspect will provide a big help in curbing the spread of this disease and eventually ending the pandemic. However, employers are not allowed to discriminate those workers who wishes not to be vaccinated for whatever reason. DOLE, DTI, and concerned local government unit will do the monitoring of the compliances of the establishments. Non-compliance will be dealt with in accordance with existing laws and regulations. At this time of the pandemic, our goal is to survive all these challenges brought about by COVID-19. One of those challenges is to make sure that our workplace, our source of income, will always be safe and healthy from this disease. Thank you for listening. Good evening, everyone.
Thank you, Dr. Ferrante. For our second speaker, let me call on Dr. Cruz to discuss the topic Quezon City COVID-19 Workplace Response.
Thank you, Dr. And good evening, everyone.
Good evening.
Can you hear me? Let me share my slide. Can you hear me po?
Yes, loud and clear.
Thank you, Dr.
You're welcome.
So again, thank you for inviting the Quezon City Epidemiology and Surveillance Unit. So let me just introduce you to our unit, our activities during this pandemic. So since before the pandemic, we have already what we call public health surveillance existing in our country. So this is under the Philippine Integrated Disease Surveillance Unit. And ang nagpapatakbo po dyan ay yung mga tinatawag na ng dating Local Epidemiology and Surveillance Unit. So in Quezon City, we call it Quezon City Epidemiology and Surveillance Unit. So we are responsible in doing disease surveillance of the existing notifiable diseases in our country. And also outbreak investigation. So during this pandemic, ang mga local epidemiology and surveillance unit are also responsible for or leading the contact tracing efforts of each cities in the country. So yun po yung trabaho ng epidemiology and disease surveillance unit. So in Quezon City, we started before the pandemic, around 10 people now in the pandemic, before the pandemic, but now we are now close to 260 people in our unit to respond efficiently dun sa what's happening in our country right now. So in part of our work is to conduct what you call workplace surveillance. So this is very important. The lecture before this lecture talks about ano yung guidance natin on if you are a workers or if you are an employers. What will you do if there are existing COVID cases in your workplaces? So important yung tinatawag nating workplace surveillance. Paano po ba natin ginagawa itong workplace surveillance? So it started with a group of well-trained contact tracers that conducts comprehensive investigation and intensive contact tracing on company-wide transmission. So na-mention po kanina, so na ang workplaces right now is affected by the pandemic, especially this year. Mas marami kaming nakukuha o nakikita ng mga employees or na nagkakaroon ng transmission in their workplaces this year compared to our surge na nakita last year. So if you're going to see the table ang workplace exposure is actually among the highest, no, dun sa nakikita natin, na-identify natin na exposure among the COVID cases natin dito sa Quezon City. So especially among those workplaces na marami yung mga empleyado and yung mga nahihirapan mag-work from home scenario. No? So there are several guidelines on how to do yung tinatawag nating contact tracing sa workplace. No? Isa na rito yung mga DOH memorandum na inilabas natin on how to do a prevention, detection, isolation, treatment, and reintegration strategies for COVID-19. Ito po yung pinafollow natin in guide natin also for contact tracing. And then there is this law, no, RA 1133-2, or the law of notifiable diseases. Previous years, ang mga ospital lang ang nire-require mag-report ng mga notifiable diseases. But because of this pandemic, nagkaroon ng revisions dun sa law, in-include na yung mga workplaces as part of the disease reporting units. No? Ibig sabihin, ang mga employers ay required to report a notifiable diseases. So in this pandemic, yung ating COVID-19. So it is covered by, or it is guided by the Republic Act 1133-2. So in this law, nakikita natin dito, private companies and institutions or workplaces are actually are considered as disease reporting units, as I mentioned earlier. No? So they need to establish or designate a unit that will perform the functions within the respective premises. So pagka mag-a-adapt sila, magkakaroon sila ng sarili nilang disease reporting coordinators. So yun ang tinatawag natin. Usually ang mga existing workplaces ngayon, ang ginagamit nila as disease coordinators ay yung mga health and safety protocol officers nila. No? They should participate in disease response activity by reporting health events to their local health office using the event-based surveillance form within the 24 hours upon identification. So ang COVID-19 kasi belongs to the category 1 ng notifiable diseases. Ibig sabihin ng category 1, you need to report it within 24 hours. No? Kailangan ma-report siya sa local health authorities, hindi lalagpas sa 24 hours. No? So you have to report immediately. So it is also, they are also expected to provide adequate support for their workforce in terms of transportation, lodging, food allowance, and other appropriate assistance. No? Especially those who are afflicted with the COVID-19. So, similarly, our city issued also a memorandum for enhanced contact tracing and other health requirement for large workforces. Kasi nga nakita natin na in companies or employers or workplaces na maraming nagtatrabaho, ang taas ng transmission rate. No? So nakikita natin na we need to issue more guidance for this kind of workplaces para maiwasan yung transmission dun sa loob. So ano ba yung objective nito? So ang objective ng workplace surveillance is for early detection of COVID-19 cases. So ginawang disease reporting units ang mga workplace para ma-report agad-agad sa local health authorities, no, ang case of a COVID-19 in their workplaces. Bakit kailangan ito? Para ma-stop natin yung current spread of the virus and prevent future transmission. So important na makita kung ano nag-cause o bakit nagkaroon ng transmission within the workplace so that hindi na natin ito maulit, no? So ano yung process of investigation? So ang ginagawa po natin dito is a evidence-based step, no, on how to do contact tracing in a workplace. So of course, kailangan ma-receive namin yung report na merong kaso dun sa inyong workplaces, no? And then employment verification, bine-verify namin kung kung totoo ba yung report na yon, kasi baka mamaya chismis lang siya or meron lang naninira dun sa company nyo, or meron lang disgruntled na employee, no? So kaya siya nire-report na merong case sa isang company. And then we request appropriate data, and then we verify, and then we update and recommend control measures. And then we issue a company clearance na okay na, tapos na yung what is needed to be done in control of the transmission in the workplace, and then we close the case, no? So these are the steps that are needed para matapos natin yung investigation dun sa workplace. So let me take you one by one. Ano yung ginagawa natin? So sa initial report, ang QCSS will receive report of positive cases through different channels, no? One is of course yung aming COVID-19 hotline. Marami po kaming natatanggap na report sa aming hotlines, no? Na several numbers namin here in our office na may anonymously reporting of COVID-19 hotline, or even yung mga employers mismo, yung mga health and safety officers nila tumatawag sa amin para ma-inform na meron silang COVID case doon sa kanilang company or workplace. And also we are receiving reports from the social media, particularly sa Facebook, no? Ang daming nagme-message sa amin through our page na meron silang ganitong kaso sa kanilang lugar, sa kanilang workplace, and asking for a response from us, no? And then of course, so email and other news or social media trends. So pag nakikita namin yan sa news na merong kaso sa sikat na workplace, no? So yan ay initiate investigations on our part. And then employment verification. This process ensures that initially the initial report case is an active employee of the company. Kailangan ma-establish namin yung employment ng company if it has been present in the company in the duration of infectiousness. Ibig sabihin, kailangan ma-establish namin kung ang isang COVID-19 case ay ang kanyang day of infectiousness or fall within the employment status niya dun sa company. Dapat na andun siya. Kailangan establish namin yun correctly, no? If not, kasi magkakamali yung direction ng investigation. And then we request data, no? We request information or data immediately to the employers or through the employers, either to the health and safety officers nila or sa kanilang personal department, no? So there are several so mag-email kami dun sa kanila, including yung mga company reporting file. This is several files na kailangan i-accomplish ng company, and then we issued we send them also copies of the different memorandums and law, and then yung the zero reporting letter, no? So kailangan yan, lahat yan ay sinasabit natin dun sa workplaces or employers na meron kaming na-receive na information na sa kanila ay merong COVID case either through the different sources of information. No? And then this is an example of a company reporting format for a confirmed case. No? So yan ang pipill upan ng isang ng health and safety officer or kanilang disease surveillance coordinator or ng kanilang HR, no? So yung ang lalagay dito yung information about the confirmed case. So importante na ma-fill upan lahat yung mga kailangan namin dito para maka-initiate kami ng investigation. And then of course, this is the most important, yung close contact form, no? So ina-ask din namin yung employers or this health and safety officer nila na ma-fill out to na maigi, no? So usually nahirapan dito kasi nga pag hindi na trained yung health and safety officers on how to conduct a contact tracing, medyo nahirapan sila fill upan to. And then of course, yung mga suspected or cases na pinauwi nila. No? Excuse me. So the second, the fourth step is yung case verification. So once requested data is received, investigation will now begin. No? The following are verified. No? Of course, yung contact classification, ina-identify natin kung sino talaga yung mga close contact. So minsan dito kasi nagkakagulo, no? Nagkakagulo sa office kasi nirereklamo bakit daw hindi pa nagla-lockdown yung office, bakit hindi nagsasara yung office kasi ang dami ng case. So kailangan importante sa mga maintindihan ng bawat empleyado or bawat empleyado sa isang workplace kung ano yung mga dapat information na kailangan nilang matutunan. Ano? For example, ano ba yung definition ng isang close contact? Ano ba yung definition ng isang second degree close contact? And then ano ba yung mga general contact nating sinasabihan? And then of course, yung mga suspect cases. And suspect cases, these are employees who exhibiting symptoms na hindi pa natin nako-confirm kung ito ay COVID case. Kaya lang pinapauwi, no? Pinapauwi agad without kasi nga may symptoms pumasok, so pinauwi siya ng kanyang mga employers. So kailangan yan ma-verify natin. So these are the different definition of close contact, no? Pag sinabi natin close contact, ito nga yung nag-interact with a positive patient or a positive employee for more than 15 minutes and less than 1 meter in distance. No? So this is regardless of if the COVID case or the close contact is wearing any face mask or not. No? So it was within an enclosed space for more than 2 hours, ibig sabihin nagstay talaga dun sa an office na enclosed, na walang ventilation. And of course, yung mga household ng patient. So household, inaalam din kasi namin sino-sino yung mga kasama sa bahay ng isang employee. No? Kasi part po yan ng contact tracing na ginagawa natin. Then ang second degree contact, close contact, ay yung mga close contact ng mga close contacts. So for example, ang isang employee ay may na-identify na close contact na kasama niya dun sa kanyang office, and then yung yung kanya namang ka-office mate na yun na close contact niya ay nakipag-meeting sa kabilang room o sa kabilang floor ng office na yon. Those na naka-meeting niya will be now considered as a second degree close contact, and of course yung mga general contacts, no? So these are the three different information na kailangan natin makita. So dapat ma-identify to properly ng inyong health and safety officer or yung kanyang disease surveillance coordinator in your workplace. So ang speech step is yung ating to update and provide direction. So ang ginagawa dyan, lahat po na mga na-identified na close contact after submitting it to us, tinatawagan po yan isa-isa. Kinukuha namin yung mga contact numbers yan. So hindi pwedeng walang mobile numbers na ipoprovide. So ang gagawin, kakausapin sila ng ating mga workplace surveillance officer, i-identify kung talaga silang close contact, and then ipo-provide sa kanila information kung ano yung dapat nilang gawin. One is sasabihin dun sa employees or to the company sino yung mga dapat magpa-test at kailan. So importante na ma-determine natin kung kailan isa-subject for PCR o antigen testing yung mga na-expose or close contacts na kailangan i-discuss yan with the company para magawa siya ng maayos. Second is yung duration of our quarantine period. Dalawa po yan, duration of quarantine period or isolation period ng COVID case and also ng mga close contact. Dinidiscuss po yan sa kanila. So pag ikaw ay na-determine as close contact, ang iyong quarantine period is actually 14 days. Diretso po yun. Kahit matest ka man, after 5 to 7 days, matest ka man, kahit mag-negative ka doon, diretso po rin yung quarantine period mo to 14 days. So yan ay dapat na di-discuss with the company and also to those employees. And then we issue a company clearance or certificate of completion of quarantine sa mga barangay. Ini-issue to dun sa mga employees. So sa number one instructions namin sa mga employees na nagiging close contact or COVID positive, dapat they have to inform yung ating BERT, o BHERT ang tawag nila dito, yung Barangay Health Emergency Response Team. They need to inform them kasi binibigyan sila ng certificate of completion of quarantine na totoo bang nag-quarantine ang isang COVID case or isang close contact. Kasi sila yung nagmo-monitor. So sila yung nagmo-monitor dun sa barangay where the patient or the employers live. So importante yan, ulitin ko po, importante na ma-inform nyo yung kanyang BHERTs para ma-conduct nila yung trabaho nila na to monitor you and also to provide you with assistance kung magkakailangan natin during emergency. So also we discuss sa company anong nangyari. So we will provide recommendations para hindi na siya maulit kung ang transmission ba ay nag-occur dun sa company mismo. Baka kulang yung public pag-promote ng public health standard within the workplace. So kailangan ma-discuss dun sa company. And then we encourage zero case reporting. This is very important. Zero case reporting, ibig sabihin, every day, magre-report ang inyong disease surveillance coordinator o yung kanyang health and safety officer to CESU na wala silang case. So zero report. Magsasend lang naman po yan ng email. Magsasend sila ng email sa atin. Sabihin lang nila, we have zero report for today. So yan, napaka-importante po niyan. So that we will know na wala talagang kaso na nag-occur uli dun sa inyong workplaces. So as of today, we have 226 business or workplaces na nagre-report po sa atin. So also within our local government offices, minomonitor po din namin yan. And then we have 34 national government workplaces in Quezon City na nagre-report sa atin. So all in all, around close to 300 workplaces ang minomonitor natin dito sa Quezon City. Nagsasubmit sa atin ng zero reporting or kung meron silang COVID case, so para ma-initiate natin yung response natin. So we have several teams in our work surveillance team, no, na nag-investigate sa mga cases natin dito sa mga workplaces natin dito sa Quezon City. And then this is our hotline. You can reach us through these different numbers and email addresses so that you're able to report cases of COVID in your workplaces so that we can initiate investigation immediately. And of course, we have to encourage everyone to use QC Pass, no? Ang QC Pass is the QR code of Quezon City, no, na very important na meron ang bawat opisina. Hindi lang yung mga business establishment, no, even the private offices, no, kailangan meron silang ganito so that when we conduct contact tracing, mabilis na namin ma-retrieve yung mga data that are needed for contact tracing. So this is provided by Quezon City for free, no? Kailangan nyo lang mag-avail nito and using the link dito sa nakikita nyo sa baba. All right, so that's it for me for my lecture, and thank you everyone.
Thank you, Dr. Cruz. For the topic, establishing resilient business during the pandemic, let me call on Dr. Renales.
Can I share my screen? Thank you
Go
so
ahead,
much,
Dr.
Dr. Gox.
You're welcome,
No,
Dr.
I cannot share my
Renales.
screen. Yes, okay, thank you. Good evening, everyone. So let's move on to the next and the last topic for tonight is establishing resilient business during pandemic as we celebrate the World Day for Safety and Health at Work 2021. This is a very short presentation focusing on the ILO. And for the introduction, we will deal with some of the background and then strengthening OSH management systems at the enterprise level. And we can look at the key points to summarize this presentation. So for the introduction, let's define business resilience. Resilience is the ability of a business to withstand, adapt, and thrive in the face of shocks that are internal and external, as well as known and unanticipated, just like COVID-19. As a background, according to the ILO report, the COVID-19 pandemic is a global challenge for safety and health at work. And the theme, as we have said, is focusing now on how to respond to invest now in resilient OSH systems. So in some cases, COVID-19 infections may be attributed to workplace exposure, like the healthcare and social care. Possible sources of outbreak of the virus are workplaces where workers spend time indoors in close proximity and during work interactions, share accommodation, and transport, based on WHO 2020. Now, there is this figure from the ILO as well, saying about 65% of enterprises surveyed that the worker morale has been difficult to sustain while teleworking, and 18.7 greater odds of transmission compared to open air environments. And so they have also 136 million here as estimates and 7,000 healthcare workers deaths. In European cases, 25% of cases are among healthcare workers. and so forth. And as you see the next figure here, we can see that in the engineering controls from based on their survey, you can see 73% of ventilation, air filters, physical barrier, 64%, and also marker tape on the floor for one-way system of movement. For the other organizational administrative measures, you have teleworking 82%, holding meetings virtually, physical distancing 73, and so forth. You have measures to control other risks and making sure that there are breaks, keeping workers updated, discontinuing non-essential travel, training of workers, and the working time arrangements, and of course the PPE that is about the wearing of face shield and face mask, and the apat dapat to consider that also in the workplace. So ILO recognizes COVID-19 as an occupational disease, but they have considerations as a general guidance. So in broad terms, as an occupational disease, the worker is exposed to a specific risk, and risk should be deemed to be the determining cause of the illness. If the illness is listed in the National List of Occupational Diseases, the occupational origin shall be presumed to exist. If the illness is not listed, and national legislation allows for other diseases other than the ones included in the list to be declared as an occupational disease, the following must be proven: existence of the occupational risk and a causal link between occupational risk and illness. Now, there are also incentives for promoting compliance among employers to invest in OSH during this pandemic. So while they have this, there can be some help in the revenues in many sectors, and tax incentives, insurance-related incentives, matching funds, and non-financial incentives based on the EU OSHA 2021. How about the scope and functions of the occupational health services during the COVID-19 crisis? The same from the ILO convention will apply during the pandemic. So as you can see here, these are the same functions, like the risks, to identify it, assess, and surveillance of the factors in the work environment, advice on the planning and organization of work, participation in development of programs, advice on occupational health, safety, and hygiene, and on ergonomics and individual and collective protective equipment, surveillance of workers' health in relation to work, promotion of the adaptation of work to the worker, and contribution to measures of vocational rehabilitation. Also, including collaboration in providing information, training, and education in the fields of occupational health, hygiene, and ergonomics, organization of first aid and emergency treatment, and participation in the analysis of occupational accidents and occupational diseases. And now this will include, of course, COVID, because we are submitting COVID by ear every month. So in risk assessment for COVID-19, this ILO report talks about low exposure risk, and these are jobs or works without frequent close contact with the general public or others. Some examples will include remote workers working from home, office workers without frequent close contact with or others, and workers providing teleservices. How about medium exposure risk? We have jobs or tasks with close, frequent contact with the general public or others. And this will apply to the work with close contact, people in high population density environments, food markets, bus stations, public transport, other work activities where the physical distancing of at least 1 meter may be difficult to observe, or tasks that require close and frequent contact between co-workers. So it may also include frequent contact with people returning from areas with community transmission. So frontline workers, retail, in-home deliveries, accommodation, construction, police and security, public transport, water, and sanitation. Now, what about high risk? So the ILO talks about jobs or tasks with close contact with people who may be more likely to have COVID-19. So we see this in the healthcare industry, as well as contact with objects and services possibly contaminated with the virus. And so examples are COVID-19 suspects, and there's no separation between the driver and the passenger, or domestic services, massage, home care, salon, having contact with deceased, or being suspected of having COVID-19 at the time of their death. So there's some close contact. And the jobs that may fall under this category include domestic workers, social care workers, personal transport, and home delivery providers and home repair technicians, plumbers, electricians, who have to provide services in the homes of people with COVID-19. Now let's move on to strengthening OSH management systems at the enterprise level. This is the focus of our topic this evening. The first one, ILO recommends promoting cooperation between management, workers, and representatives in the workplace. And so we have this to promote and create a safety culture. With the safety culture that we have, because we are, of course, in compliance with 11058. So that safety culture must have been there, but we are only adding our resilience right now because of this unanticipated COVID crisis. Then promoting work engagement. They must be involved somehow in meetings, toolbox meetings as well, virtual meetings, and they're also involved in planning regarding some new guidelines that the company specifically making its policies in compliance also with the government protocols. Thirdly, providing a sense of ownership among workers. They own their health and safety, and so they know also how to report, to notify. They can also coach their co-workers and not be afraid to coach each and everyone if they're not following the minimum health and safety protocols. Next is conducting a comprehensive risk assessment. Let's not forget that HIRAC is very important, and ILO recommends this. So a regular hazard identification risk assessment, as you have heard from the two topics, the COVID-19 and the workplace, as well as in the CESU report, you can see from there that HIRAC is very important and adoption of OSH measures to prevent COVID-19 transmission in the workplace, just complying with the DTI-DOLE guidelines as well as other protocols. The third one, management of change during the COVID-19 crisis. This is an ever-changing environment that we have. And I think you're convinced by now that even after a year, we're still in the ECQ, MECQ mode, and now there's a new name, flexible ECQ, that they're trying to propose. And so how will management really address this? And OSH is at the forefront because this is about health and safety against COVID-19. So we have here the fourth one, addressing psychosocial risks during the COVID-19 pandemic. Now, it used to be that work from home was exciting among workers, but lately, even in the companies where I handle right now, that they're complaining of boredom, anxiety, and they want to go out of the house, but they can't because of age and also some comorbidities. And so those are the factors that make them stay at home. But there are psychosocial risks that are really happening. And emergency prevention, preparedness, and response. So what do we do if somebody comes to work and most people who answer the health declaration form are not telling the truth? So do we have some guidelines for that? Can we address that? And we have to follow really strictly the protocols that the government has laid down for us. The third one is support mechanisms for the progressive improvement of the MSMEs, the medium to small scale, the micro, small, and the medium enterprises, and the informal economy, if there are in the community. And there's really a need for training information campaign on health and safety. So right now, informal economy workers can be affected by what we call the community pantry because of it's a mass spreader and people flock to this, and they also sell here or they also donate some of them for informal economy workers. So how can we support them also? Because this is part of the community. And sometimes in corporate social responsibility, we see this as also in the vicinity. And we don't want any mass spreaders. And that's why right now, all the protocols are focusing on individuality. You eat by yourself, and then when you meet, it's virtual, and then you don't have a companion. And even at home, you must already be wearing a face mask and observe physical distancing and open windows. Why? That is an IATF recommendation because of home transmission. So these are the three recommendations by the ILO in its report for this 2021 World Day for Safety and Health at Work. So looking forward to the resilient OSH systems to face the next crisis. We're not sure how long this COVID-19 is going to stay in the world. And so the workers keep on running the risk of contracting the virus at the workplace. And right now, if we're going to move into flexible MECQ or flexible, MECQ here, if they approve it, so what's going to happen is that economies will start to open again. We have our workers, they'll be at risk of contracting this and bring it back to their own homes. Some companies would quarantine or put their workers, like construction, in a particular facility, and that they cannot go home unless they have a leave or something, and then when they go back to the construction, they get tested for antigen. So next is increase in teleworking arrangements. This is part of resilience. Closure of many commercial manufacturing activities. And so retrenchment, this is one of the problems that our workers may be facing during the next crisis. The fourth one, ILO also cites the importance of strengthening and creating resilient OSH systems. Importance of OSH, therefore, is a key actor within the broader national emergency response and public health system. And the key is investing really in it. So we have heard also our executive director, Binag, talk about that a while ago. And DOLE has, of course, activities to augment and to help those suffering economies in the industry. And so with this is the end of presentation, but I'd like to cite these key points. First is to promote cooperation between management, workers, and representatives. We must involve all these sectors of the company where we work for and conduct a comprehensive risk assessment, provide support mechanisms for improvement of the OSH, even in the micro, the small, and medium enterprises and informal economy, if we do support these groups aside from the large companies. And lastly, continue to create resilient OSH systems to face the next crisis. With this, thank you very much and happy World Safety and Health Day at Work.
Thank you, Dr. Renales. For our open forum, let me introduce to you our chapter chair, Finance Committee, Dr. Jason John J. Kapihang.
Thank you, Dr. Ku, and thank you to our distinguished panelists. Happy World Day for Safety and Health at Work sa inyong lahat. Ako po ay si Dr. Jason Cabigon, ang inyong moderator ngayong gabi. At this point, we'll be opening the floor for comments and questions. And looking at the chat, it seems most of our participants are really engaged in our topic for tonight. So to start off, let me read the first question, and it's about the mode of transmission. So since it's about the COVID response, maybe I can direct this question to Dr. Cruz. So the question is, how is the mode of transmission determined? Its example will be either household versus workplace. And a follow-up question, what's the reason for the very high percentage of unknown modes of transmission?
Let me clarify that. So the table I showed earlier is not actually the modes of transmission. So these are actually the identified exposure of COVID-19 cases. So modes of transmission and exposure is a two different thing. So the exposure that were showed earlier, the highest is among during a surge of cases. So during surge of cases, it's very difficult to identify the exposure or sa anti-exposure cases because some of them or most of them cannot really recall saan nila nakuha yung COVID, saan sila nahawa. So the percentage of those that are identify or cannot identify where they actually got the virus is evident during surge na maraming kaso. So ang second is yung household transmission. Of course, this is a very common scenario at this year. No, for example, last year we don't really experience if a COVID case in a family, 2 or 3 members of the household will get the virus. No? So, but this year, almost all, no, in a family of 5, family of 4, once one magkaroon ng COVID case sa household, everyone gets the virus right now. It's probably because of the variants that we are seeing right now in our country.
Thank you, Doc, for that clarification. If I may direct also the next 2 questions to your office, it's related also to COVID response. So the next question is about contact tracing. So stats from the IATF reveal that contact tracing and case investigation in the Philippines is still low and slow. What are the gaps of the current contact tracing and case investigation processes that are being done?
I'm sorry, my internet. Can you repeat that question, please?
Sorry, Dr. Cruz. So let me just repeat. Stats from the IATF revealed that contact tracing and case investigation in the Philippines is still low and slow. What are the gaps of the current contact tracing and case investigation processes that are being done?
So yes, it's true. Actually, no, unfortunately, it's true. So we, for example, the ideal ratio for a contact tracer to a COVID case is 1 to 800. No? So for Quezon City, for example, a population of 3 million, we need close to 3,000 contact tracer to efficiently conduct a contact tracing activities. No? So that's 1. So we don't have that. No? Overall, Quezon City has only around 1,300 contact tracers. No? So when you have surge like this, that you have a daily average case of 1,000 cases in a city, and then you have only 1,300 contact tracers to do the contact tracing activity, it's really mabagal, no? Mabagal yan, difficult, no? And also, we still have Philippines yet to establish a digital contact tracing platform. No, hindi pa natin nagagawa yan masyado dito sa Pilipinas. So that's one of the most challenging for contact tracers at this time. So another gap is, of course, contact tracing is relatively new. No, it requires skills. It cannot just be learned by a online seminar or online training. No, yes, you have to teach yung contact tracers how to investigate a COVID case. No? So the science of contact tracing is really very technical.
Thank you, Doc, for those answers. The next question is about protocols being implemented in a workplace. So if I may direct the questions to both Drs. Florante and Dr. Arenales. So the question is, we are now more than a year into the pandemic, yet cases are still high. What are your suggestions to strengthen our preventive measures in the workplace? Dr. Florante, if you may.
Thank you very much. The law actually, I mean, yung yung issuances kasi natin, yung batas natin will still require, and we will still be playing around yung tamang pagsusot ng face mask, frequent hand washing, physical distancing, so on and so forth. The usual, the basic. Kasi yun din naman ang tamang preventive and control measures in addressing this health concern, particular health concern. However, pumapasok na ngayon yung bakuna, and siguro advocacy on na as much as possible lahat ng ating mga kasamahan sa trabaho ay makapagpabakuna para makatulong din mabawasan ang paglaganap ng sakit na ito.
Yeah. So with that question, remember you have safety officers. Let's start with that. Their compliance with safety officers. What are they doing right now? If you are the OH physician, are you the only one moving? Are you not meeting them, talking with them, holding a lot of health and safety committee meetings to engage the safety officers? It's about time. Your SO1 can do something about it. So when you engage the SO1 or the SOs, then you can form a network, and you can help. There's a contributing factor to help prevent, because you have a lot of marshals. If there's no work from home, then that's the more you need these safety officers to work and be in touch with a certain group of workers so that they can help you monitor. So when it's a health problem, probably that's when the healthcare personnel should be involved. It's a healthcare problem, but you're also on top, and you are collaborating, working together with the safety officers. So that is something that has not yet been discussed even in some of the webinars. Let's look at our safety officers and collaborate with them, because we need to really marshal, we need to really check and do some spot audits if people are doing the right protocols. So it's even the skeletal workforce right now that's happening. So there must be some kind of collaboration there. There's a program on the protocols. So that's all. I hope it helps.
Thank you, Dr. Florante and Dr. Renales. Indeed, we need to focus on those things and those measures. Thank you. The next question, actually marami nagtatanong about the certificate of completion of quarantine in the chat. So maybe I can direct this question again to Dr. Cruz. So Dr. Cruz, sino po ba talaga dapat ang pumirma ng ating completion of quarantine? Is it really the physician? Pwede na po ba ang barangay officials or the nurse in the barangay health emergency response team?
So yung dalawang klase po kasi yan. So one declaring a COVID case recovered. So that's the only the physician can actually do that. No? A licensed medical officer can actually do that. Wala nang iba po. So yun lang po siya. So ang ibang barangay ay nagre-require na completion of quarantine, no? Quarantine measure. So yun ang ginagawa naman po yun ng mga barangay. So kasi we have to be strict yung mga COVID cases ay dapat tinatapos nila yung kanilang quarantine measures o quarantine period, and also their close contacts. No? Importante po yun. So kunyari, may tanong ako nakita na if the COVID case are in the quarantine facility, sino yung magmo-monitor? Of course, yung andun sa quarantine facilities. But for the family or the close contact of this COVID case, ang births po kasi ang nagmo-monitor dyan. So you have to inform the barangay so that they be able to issue a completion of quarantine, no, period. Ang nagiging problema as of this time ay pag kailangan niya na ng employee yung ganong certification, tsaka lang siya mag-i-inform dun sa barangay. So of course, yung barangay will refuse to give these employees a certificate kasi hindi nila alam, hindi sila na-inform na nandun pala yun, na nag-quarantine pala siya doon. So yun ang nagiging problema natin dito ngayon. So again, we have to talk to our employees and to our safety officers na kailangan nilang sabihin dun sa kanilang mga employees na they have to inform, no, to their barangay, so para ma-monitor sila so that they can be issued a certificate of completion of quarantine.
See. Thank you, Dr. Cruz, for that clarification. So since we are talking of birth, the next question is also relating to that line of thought. So any suggestions po ba, Dr. Cruz, if the employee went to home quarantine without informing the birth? And also as a follow-up question, will the close contacts be monitored by the birth as well?
So, yun nga yung sinabi ko kanina. So, yes, lahat po. For example, if you are staying or you are doing home quarantine, all of you in that household is needs to quarantine also, No, walang exception. So, you need to finish yung 14 days quarantine. For the household or the close contact, 14 days yung prescribed quarantine period, no? But if you are a COVID case and symptomatic or mild, 10 days lang sana. Pero if you're staying in the household, of course, damay ka na doon sa 14 days na quarantine period. So wala pong exception yan. So kailangan ma-provide, tapusin po yan ng mga naandun sa house. So, kahit nasasabihin na, kasi minsan sinasabi po na I'm staying in my own room, no? Hindi ko nakakausap yung family members ko. Kahit po ganun ang scenario, ini-issuehan po natin ng quarantine order lahat na nandun sa household. So yun po yung ginagawa ng ating CESO officers when they do contact tracing. We issue a quarantine order dun sa mga close contacts and of course dun sa COVID case. So nakalagay po dun kung kailan matatapos yung quarantine period mo. Kailan magsisimula at kailan matatapos. And then the births monitored, yung compliance po. And of course, I have to mention na liable ang anyone who breaks the quarantine protocol. Andun po yan sa ating law of notifiable disease. Pag hindi niyo po sinunod dyan, ay liable po kayo dun sa batas natin. Marami na po kaming nasampulan. Mga ganyan.
Thank you, Dr. Cruz, for clarifying that point. No, actually, your last statement answered a lot of questions already regarding breaking our national policies. So the next question is again about policies in the workplace. So maybe I can direct the question to Dr. Florante and Dr. Arenales. So if an employee contracts COVID outside the workplace, what is the role of the employer if meron man?
Sino mo na?
Dr. Florante, if you may.
Go first.
Sige.
Because I practice. Remember, it's still the employee of the company. So it's still an employee of the employer. So if ever it's outside, you still take care of your employees. So, but the cost of the testing, let's say you have to subject for RT-PCR, okay? That will differ. Maybe an HMO can cover it, because some HMOs are covering now for the expense of the RT-PCR. So if they cut it outside, it's okay to undergo those tests as recommended. So it's the employer still has to take care of the employee and report to the BHERT. You have to report so that you have a clearance. And of course, if there's the OH physician is there, then can also look at those clearances and recommend to management. If, from telemed, by bio-telemed, you can do that. And also issue a medical clearance. So that would be all. But you still have to take care of the employee. Okay. Not only work-related cases or the risk was found inside the workplace.
Yes, tama po si Dr. Renales. Kahit yung kaso o yung kaso niya ay nakuha niya sa community rather than the workplace, kahit papaano, may role pa din si employer to report to to encourage the worker na i-report yung sarili niya sa BERT, or the LESU, or the Local Epidemiology and Surveillance Unit. Pangalawa, kasi ilalagay din ng employer, i-report niya ng employer sa wire COVID. So, i-report pa rin niya yun sa BERT o di kaya sa Local Epidemiology and Surveillance Unit. So, malaki ang role actually ng Safety and Health Committee pagdating dito sa COVID-19, lalo na sa reporting and notification. And ang kailangan lang ay ma-inform lahat ng manggagawa, workers, na if and when kahit naka-work from home ka, nagkaroon ka ng karamdaman, influenza-like illness, o di kaya nag-positive ka, kailangan malaman ng Safety and Health Committee o kung may company physician, malaman ng company physician para at least ma-direct si worker kung anong gagawin at ma-direct doon sa BERT or sa Local Epidemiology and Surveillance Unit. Thank you.
Thank you.
If I may add, Doc Jason and Doc Jane, that's why an OH physician has an additional task, being a call center agent. I'm not kidding. Telemedicine, and then he also do call center. Why? You're a call center, you call all the BHERTs, you call 1555, or you call 122 if you're in Quezon City. So all of those, and then you also call one hospital command, you see? So our directory has expanded. It's not only the one found in the clinic, it's all of these numbers that involve the COVID-19. That's all.
Thank you, Dr. Renales.
Can I add something?
Go ahead, Dr. Cruz.
So tama po yun. Pero ang kailangan po natin is be careful on establishing yung exposure. Kailangan ma-establish natin siya mabuti ng health and safety officers natin. Why? Kasi ang daming nagkiklaim ng mga workplaces na, oy, sa community naman niya nakuha yan eh. Mga ganun. Pero actually, hindi naman. So let's be careful on establishing your exposure. You can only do that pagka nagawa na maganda yung contact tracing activity. No? Of course, if the workers is working from home, obviously hindi na yun kasama doon. So, but if the client is actually going to work, no, and then nagkaroon siya ng COVID, a contact tracing activity must be initiated before we can establish that this is not a workplace incident or workplace transmission. So, importante po yun. Doon kami minsan nagkakagulo, no? Nakikipag-away sa mga employers. No? So, and also have to mention na the most common violations ng health ng mga workplaces are yung mga nagko-conduct ng mga face-to-face meeting, and then nagkakaroon ng lunch together after the meeting or after conducting a meeting, nagka-conduct ng of course, di ba, pagka may meeting, may pagkain, ano? And then everyone eats together, and then the following day, merong magkakaubo, magkakasipon, and then COVID pala. So everyone is actually in that meeting are COVID case already. So marami pong ganong senaryo, no? So paulit-ulit actually, no? So yun lang po, reminders lang, no, on establishing exposure. Dapat we should be careful on that. Baka magkamali tayo dun sa guidance, no?
Thank you, doctors, for the answers. Indeed, no, hindi pa rin talaga labas, kumbaga, automatic yung employer. If, again, so through initial reports, sa labas nakuha ng employee, kailangan pa rin ng further investigation. Regarding, since we are now sa testing Many questions are pertaining to the laboratories, Dr. Cruz. Meron bang responsibility ang mga laboratories, for example, the turnout time of their results to be submitted into your office? Or what if nagkaroon ng certain problem after 7 days pa ni-release ng lab and it deemed na positive pala yung patient? Will there be something na mababiolate ang ating mga laboratories?
So, a very difficult question. If laboratories are liable for those. Of course, during surge kasi, no? So, sa dami ng tinetest ng mga laboratories natin, nagkakaroon minsan ng longer turnaround time. No? Yung last experience namin ay this year ay inabot ng 7 days before nilabas yung result. No? So that's really not good. No? But the most important thing to us or to the workplaces or to employees, hindi po importante masyado yung testing. Okay? The most important thing is yung isolation or quarantine. If you are having symptoms, i-isolate mo agad yung sarili mo, and then so that to avoid infecting others. So that's the most important thing right now. Hindi yung test ang agad ang nasa isip natin. So isolation, quarantine muna. If you have been exposed to a COVID case, i-quarantine mo na yung sarili mo or i-isolate mo na yung sarili mo if you have symptoms. No? So that's the most important. Ito yung, kaya lang ang nangyayari kasi ngayon, lahat nagmamadali matest as if parang antibiotics or gamot yung testing. No? So it's not. No? Importante. Kahit hindi ka actually matest, if you isolate for 10 days, kahit may mild symptoms ka, isolate for 10 days, gagaling ka eh. Or if you are a close contact matapos may 14 days, okay lang po yan kahit hindi ka matest. No? So, ibig sabihin yun, hindi nag-expand yung infection, hindi ka nakahawa. No? So, that's the most important thing right now para ma-prevent natin yung more cases. So, ang testing will only come in especially dun sa mga may symptoms. Kaso pagka ganyan, ang hirap minsan, ano? If you PCR ka and then your result will come in 7 days after, no? Wala ka ng symptoms, dadating na yun. Tsaka palang darating yung case mo, sasabihin sa COVID ka, no? So, yun. But if you isolate yourself, yun the most important. You have to reiterate that every time. No? Parati ko pong sinasabi yun. Huwag po kayong, yung minsan nagmamadali sila yung family nila, gusto nila matest agad, eh hindi nga ma-respond ng gobyerno kasi ang daming nagkakaroon ng cases during surge, di ba? So, hindi kami makarespond agad dun sa family na nagkakaroon ng cases. So, the most important thing is to isolate and quarantine before anything else. So yun po yun.
Thank you, Dr. Cruz. No? And also you answered the next question na hindi talaga requirement din yung testing, especially kung screening lang, at if nakompleto na yung quarantine. I think the next few questions are all related to COVID protocol. So maybe we can just take note of them and we will see how will we best answer all of the questions. And it may decrease our time, unfortunately, to discuss our main topics for today. But siguro, just last question to Dr. Renales and Dr. Florante. There is one suggestion if we can create an updated guideline to the workplace or meron na po ba tayo nito? Dr. Renales?
There is already,
Meron,
and
okay.
PCOM, National is working on that with HPAC. Yes, meron po. Yeah. So, PCOM is a part of HPAC. Then HPAC recommends to IATF, through the NTF, National Task Force. I have a question. Somebody asked a direct question to me. So probably it's important because if employee as a close contact with his family member confirmed, what is the management of the employer? Okay. So if ever you encounter this, what you're going to do, ganun pa rin po yan. You have to encourage the person to test. At saka naka-quarantine na po siya for 14 days as close contact. Naka-isolate yung pinaka-COVID positive, the first index case. And that index case should be reported because you know what you have to nandito si Dr. Cruz, what CESO does, i-inspect din nila, may nag-inspect sir, di ba, yung BHERT, titinan nila yung lugar, baka walang isolation doon sa bahay, walang own CR and sariling room. Kaya pwede nilang sunduin yon. While the others, the rest of the household, will be tested also. So they will schedule the testing. Hindi yung pwedeng sabi nga ni Dr. Cruz na gusto mo agad-agad i-test. Hindi po. Kasi lalo na nga po ngayon merong waiting period of 5 to 7 days, okay, for the viral load. So, ganun pa rin po ang gagawin nyo. It's still the barangay. Remember about this COVID-19, the protocol of the government is through the LGU. So, kung nasa company po tayo, we help facilitate BHERT reporting, DOLE reporting, and also management of the employee, kung anong kailangan niya. And then ang HMO, kailangan ba hospital, pwedeng home care. So we do home care by telemed. If we have a company physician, then we can do telemed, Zoom, Messenger, social media platform. So I hope I was able to answer your question, yung direct question, nasa chat box. Thank you. You want to add something, Dr. J? Okay. I have one
Dr.
thing to
Cabigon,
say.
nakamute ka.
Dr. Jason, I just want to say something.
Go ahead, Dr.
In the companies where I work, nagkakaroon po ng employees who withhold their information, correct information, truthful information in the health declaration form. So, si Dr. Cruz baka pwedeng mag-shed ng light dito. Kasi yun ang po problema sa workplace. Gustong-gusto pumasok, but, okay, they don't mind the symptoms. They're not really conscious of their symptoms. So, papasok, tapos madidiscover mo na may sipon, may ubo. So, magsasabi na, kasi hindi na matago yung sipon at ubo, nakita ng isang worker. The health declaration form is not really truthfully answered. So, maybe an insight also from Dr. Cruz sa mga na-encounter yung cases. Dr. Cruz?
Tama yan, Dr. So,
hirap nung ganun, sir.
Yes. Apo. Hindi mo naman ma-blame kasi nga may sakit na. So,
yes.
So ang kaya importante yung minimum health standard, no, na ini-institute doon sa workplaces. Kasi kung isa man ay merong symptoms pero meron kayong social distancing doon sa lugar, hindi nag-eat together and everyone is wearing face masks and mami-minimize yung transmission. So, ang nangyayari lang is yung super spreading event, no? Yung isang may taong may symptoms, a-attend ng meeting, kasi may kainan afterwards, ayun, patay na tayo doon. So, that's something that's actually occurring.
Maganda, sir, yung QC app Kasi if ever that QC app is really mandatory, that's one way to check the health declaration. Ang sinasabi ko, sir, health declaration, they're not truthful in answering.
Yan, yes. Kaya po dapat. Opo. Kahit actually in digital, ang dali namang yun eh. No. Pero, yun nga, opo. If everyone's wearing face masks dun sa hotel and sa workplaces and adequate ventilation, we will be able to minimize yung transmission kung mag-occur man.
Thank you po. So actually, blockbuster po tayo with the questions. No? Ang dami po talaga pong remaining. But unfortunately, we have limited time and we will just take note of all of the questions. And I hope, Dr. Cruz, we can also ask for your help to answer some of these again. And then we will be forwarding the answers to all of the involved members. So at this point, siguro I will be asking our distinguished panelists to have their last words of advice. We can start with Dr. Ferrante.
Okay. Thank you. Thank you very much, Dr. Kabigan. This pandemic has actually brought us maraming challenges na sa ating buhay, ano. And I do understand that this COVID-19 is not just a respiratory illness but also a mental health concern. Pero siguro konting hakbang na lang, matatapos na rin to, matatapos din to. Ang tanging pakiusap ko lang ay sana maging totoo tayo kapag tayo mag-fill out ng mga forms. Kasi tulong din ito hindi lamang para sa sarili mo, para sa pamilya mo, kundi para rin sa kasamahan mo, para rin sa trabaho, para rin sa workplace. Kasi kung lahat maging apektado, magsasara ang kumpanya mo, paano ng income mo? Ganun din. So, may domino effect. So, at the end of the day, we really have to be very responsible of our actions and think of others when we do right, when we do answer the health declaration forms, and when we declare kung tayo ay may nararamdaman o wala. Yun lang po. Thank you very much.
Thank you, Dr. Ferrante. Dr. Renales.
So, as in what I said a while ago, it's about OSH is a key actor in this pandemic. But the touch of a physician is missing. We are in telemed, but you know when you call or a safety officer or practitioner, somebody got a COVID-19, you call the person, that means a lot to the person. So let's not forget, those who are physicians here, let's not forget that physician touch or that nursing touch, hindi ho pwedeng mawala yan sa COVID-19. Because it means a lot to our work, to our workers. And it helps them boost, have hope. Di ba po? So yun lang po ang aking parting words na to leave with you tonight. We're still a physician, we're still a healthcare worker, a nurse, kung safety officer, ganun din po. We are on health and safety advocacy. And we need to help our workers to prevent the spread of COVID-19. And to stop once and for all the transmission and even development of variants. Kasi pag mas nagkakahalubilo mga tao, nag-mutate po yung virus. Okay, so yun lang po. Thank you very much and good evening.
Thank you, Dr. Renales and Dr. Cruz.
It's a cycle po. No? Mahawa ka sa workplace, dadalhin mo sa bahay. Pagdating mo sa bahay, mahawa mo yung household, and then hawa mo yung community. So, and then when you have a community transmission, a lockdown, a more stricter lockdown na yung ating bansa, no, ating city. So ganun po siya paikot-ikot. So let's be responsible. So ang workplaces is really an important part of our everyday life. So kailangan masayawan natin siya na maigi. So ang virus na to until all of us are vaccinated, no? So konting taste na lang po. Kailangan nakapokus tayo talaga. Everyone, every individual, kung lalabas ako ng bahay, anong gagawin ko? No? Kailangan naka-face mask maigi, kailangan naka-face shield maigi. Pag mag-commute ako, dala-dala ko yung alcohol ko para kung ano man yung mahawakan ko, mag-alcohol agad. And then pagdating ko dun sa office, ay ipapractice ko rin yung mga minimum health standard natin. No? Hindi muna ako makikipag lunch together sa mga kasama, hindi ako makikipag sigarilyo sabay sa mga kasama ko, no? So parang ganun po kasi ang kailangan natin ngayon. So to prevent really another surge of cases. No, hindi pa tayo tapos sa surge na to. Ang taas pa po ng kaso natin. In Quezon City, nag-average pa po tayo ng 700 daily set cases, no? and then luluwagan na agad yung ating quarantine measures. So again, yung workplaces is under threat, no? So kailangan mag-ingat po tayo lahat. Again, tama po si Doktora at si Doc, no? Important ang role ng mga health and safety officers sa mga workplaces. So gawin po natin yung role natin na maganda, and then let's dance with the virus. Okay? Yun lang po. Maraming salamat.
Maraming salamat po, Dr. Florante, Dr. Renales, and Dr. Cruz. Marami po kami natutunan at salamat po sa lahat niyong effort, no, sa pag-try, sa pag-try po natin na maakibat, no, at matalo ito po COVID-19 pandemic. Salamat po sa inyo lahat, sa ating mga participants, and Dr. Ku. Thank you.
Thank you so much, Dr. Cabigon, and to all our panelists. Great job, everyone. So thank you, QCC Virtual Kapihang team. Excellent job to everyone. Pinapangunahan po ng aming technical head na our very own PCOM QC Chapter Secretary, Dr. Jose Angelo Taylor. Maraming salamat sa mga nag-participate ngayong gabi ito. Sana marami tayong natutunan. Mangyari po, huwag muna sana umalis para sa ating traditional photo opportunity and shout out sa huli. Okay? To formally end tonight's educational activity, ladies and gentlemen, our chapter secretary, Dr. Jose Angelo Taylor.
Thank you, Dr. Ku, for that introduction. To Honorable Josefina Belmonte, Quezon City Mayor, Engineer Noel Binag, Executive Director of OHSC. In behalf of PCOM Quezon City Chapter, we would like to extend our greatest gratitude for gracing us for your presence here at our special edition of Kapihang OH. Also, we would like to give our sincere gratitude to our resource speakers, Dr. Jeremias Florante, Vice President of PCOM QC Chapter, Dr. Rolando Cruz, City Epidemiology and Surveillance Officer, Quezon City Health Department, and Dr. Marilu Renales, Auditor, PCOM QC Chapter, for giving us information that is very important and applicable, respectively, COVID-19 and the workplace, Quezon City COVID-19 workplace response, and establishing resilient business during the pandemic. Thank you to the PCOM national officers and board members, past PCOM national presidents, PCOM chapter presidents, officers and board members, and especially to our PCOM QC chapter officers and board of directors and members. Your continuous support keeps us pushing forward in advocating the importance of safety and health. And most of all, let us not forget our guests, participants, and tripartite partners in this webinar. Thank you, and without you, this webinar will not be a success. Thank you again for your continuous patronage and chapter's activity. To the PCOM QC chapter webinar team, without you, this event will never happen. Tonight is the premiere night of three items of our PCOM QC chapter YouTube channel, 3 episodes of Ocean the Flash, and the premiere night tonight will be of the 27th Kapihang OH, Ventilation Against COVID-19. We would like also to invite you for our next Kapihang OH, living the new normal with COVID-19. This will happen on May 12, 2021, this coming Wednesday, 7:30 p.m. Our speakers will be coming from the UP National Institutes of Health. You may scan the QR code below and said poster will be posted in our official Facebook page. Again, if you do have any questions, suggestions, or collaborations with us, if you want to have collaboration with us, please do not hesitate to contact us through our social media channels or contact us through our email at Picom Quezon City Chapter at gmail.com. Once again, at Picom Quezon City Chapter, we value your safety and health. Hashtag Picom QCC Cares. Thank you and mabuhay.
Thank you, Dr. Taylor. Muli maraming salamat sa inyong pagdalo sa susunod na 28 Kapihang OH. Ako po si Dr. Margo Venus Dasalyaku na parating nagpapaalala na sa Quezon City Chapter, ang inyong kaligtasan at kalusugan ay mahalaga. Hashtag Picom QCC Cares. Good night, everyone, and stay safe and healthy.